Oh, I've been muted. I have done a whole intro. I have done a whole long intro, a whole long explanation, and I have been muted because I'm me. So, once again, because I've been muted all this time, I will have to start this whole stream all over again. So, let us begin. Welcome to the third day of researching the claim that Stephen, aka Destiny, has made about gender affirming care. Let us remind ourselves what those claims were. The claim was, we have little to no evidence for the efficacy of gender affirming care for children and adults. That's the first claim. The second claim is that everything is new regarding gender affirming care. And the third claim, I guess we could put them both together, but I will separate them. The third claim is that it is all highly experimental. It's all experimental and new. Those are the claims that Stephen has made during his discussion with Taftaj, a right-leaning trans woman. And then we have started doing our research on those claims. On the first day, we have read about gender affirming care, mostly about hormone replacement therapy, what it is, who can get it, when they can get it, what are the criteria, about psychological evaluations that you have to go in at some places, or through just consent that you can give to indicate that you understand the risks and that you want to get the treatment. Then, on the next day, we went through this article, which has challenged Stephen's claim directly. The article is called Gender Affirming Care is Not Experimental. And this article explains step by step what it means for a medical treatment to be experimental, and then also explains why gender affirming care is not experimental, and it gives counter example of treatments and medicine that are actually considered to be experimental. And this article has linked 52 studies related to gender affirming care. This assertion is quite simply untrue. A systematic literature review of research from 1991 to 2017. This is like the time scale we are looking at. So the question remains if 1991 to Stephen still counts as new. How far do you need to go? I think we established this can be an approved treatment for the last 33 years, right? So the question for Stephen would be, how far back do you need to go to not consider research to be new, right? Would Stephen just turn around and say 33 years is nothing? Is my question, right? Note that 52 studies listed here along with links to the individual studies showing overall improvement in the well-being of trans people following gender-affirming medical or surgical interventions, and studies showing mixed or null findings and zero studies that gender affirm. We have read this yesterday. We do not have to go through this portion again. So today I would like to go through the linked studies. We will read some of them. We will read the article to which the studies are attached. And after today, I will sort of go through everything that we have researched. I will create a pre-made essay-esque video, an essay-like video that will basically, in which I will discuss our findings And this video will basically serve as the refutation for Stephen's claim. That is basically our game plan. So let us go into the article now. Here. What does the scholarly research say about the effect of gender transition on transgender well-being? Right? Here we go. Overview. We conducted a systemic literature review of all peer-reviewed articles published in English between 1991 and 2017 that assessed the effect of gender transition on transgender well-being. We identified 55 studies that consist of primary research on this topic, of which 51, 93%, found that the gender transition improves the overall well-being of transgender people, while 7% report mixed or null findings. So the worst case scenario seems to be null findings. We found no studies concluding that the gender transition causes overall harm. So at worst, it's a wash. At worst, there was no negative or positive change. We found, right, as an added resource, we separately included 17 additional studies that consist of literature reviews and practitioner guidelines. Bottom line, this search found a robust international consensus in the peer-reviewed literature that gender transition, including medical treatments such as hormone therapy and surgeries, improves the overall well-being of transgender individuals. The literature also indicates that greater availability of medical and social support for gender transition contributes to better quality of life of those who identify as transgender. Okay. Below are the 8 findings of our review and links to 72 studies of which they are based. Click here to view our methodology. Click here for a printed, friendly one-pager of this research analysis. We will look through this, the methodology. Search methodology. Search methodology for a research analysis on the effect of gender transition on transgender well-being. We conducted a comprehensive literature review of all scholarly articles published in English between 1991 and June 2017 that addressed the following question. What does the scholarly research say about the effect of gender transition on transgender well-being? Our research protocol was developed in accordance with the PRISMA, Preferred Reporting Items for Systemic Reviews and Meta-Analysis guidelines. We used the PICOS, Participants, Interventions, Comparisons, Outcomes, and Study Design criteria to organize our approach to this research question. Participants: adults who have been diagnosed with gender dysphoria, who have transitioned gender, or who self-identify as transgender. Right? So this is a study made on adults, conducted on adults. Interventions: any medical service that affirms the individual's self-identified gender identity. A relevant medical service was any service, treatment, or procedure indicated for the treatment of gender dysphoria in the accepted expert standards of care for the health of transsexual, transgender, and gender non-conforming individuals maintained by the World Professional Association for Transgender Health, version 7, 2011. comparisons. No specific comparison design was required so long as the study investigated the effect of gender transition on transgender well-being outcomes. Assessment of transgender individuals' mental or social well-being, such as successful functioning, mental status, quality of life or relationship satisfaction. Study design. Any peer-reviewed study that undertook an evaluative, quantitative, or qualitative assessment of relevant outcomes for the population of interest, we did not impose requirements regarding minimum length of follow-up or other aspects of the study design. To identify eligible studies, we began by searching PubMed using the medical subject headings MESH, transgender persons, transsexualism, sex reassignment procedures, sex reassignment surgery, and health services for transgender persons, in conjunction with text words such as transgender man, transgender woman, male to female, female to male, quality of life, and outcomes. This search returned 4,347 non-duplicate articles. We then performed a hand search of journals known to address transgender issues, as well as existing literature reviews on the topic of gender transition and transgender well-being. From this search, we selected additional studies that appeared to address our research question. On the basis of title reviews, we narrowed our list to 589 studies that appeared to address our research question. We then read the abstracts of those studies and further narrowed our list based on whether the studies directly addressed well-being in the context of gender transition. This process yielded 124 studies. So as you can see, this goes pretty in depth. I'm gonna drink some water because my throat is getting a bit tired. The final step of our search was for two reviewers to independently read the full text of each article to determine if it directly addressed our research question. We eliminated studies, for instance, that did not address the outcomes of gender transition, that investigated minors instead of adults, and that evaluated physical rather than mental health outcomes, because we did not want to conflate assessments of specific surgical techniques, for example, with the broader question of whether gender transition improves well-being. Okay. We identified 56 reviewed studies consisting of primary research that met all the above criteria. We then classified them according to whether they found improved well-being, had mixed or null findings, or found that a gender transition causes harm, and reported both the numbers of studies in each category as well as 8 findings that emerged from our review of the literature. Separately from the 56 studies we included in our portal 16 additional articles that consist of literature reviews and practitioner guidelines that we did not count in our tally. We provide these as added resource for researchers, practitioners, journalists, policymakers, and the public with an interest in transgender care issues. So basically, they have left this for us. Okay. Now that we got through it, click here for a printer-friendly one page on this research analysis. This is it, and this will come in handy. This will certainly come in handy when it will come to Cornell University, right? Okay, so we have this research to possibly use when we will do the video. And then, yeah, Stephanie, have you heard what the goal is? Were you here? Did you just, hello, have you just joined? If you have just joined, then I am happy to repeat what the plan for this research basically is, and what I will be doing with our free research days after they are over. So today we will look through this article that has the studies. We will look through some studies, and after today, I will take everything that we have been talking about. After today, the plan is to take everything that we have been talking about, and I will basically create a summary of our findings with attached materials, and then I will create a video essay, like video about our findings from the research, and that video will be a direct rebuttal to claims such as the ones that Stephen has made, and such as the ones that countless legislators make, right? So that is basically our plan. And now we are going through it. We have looked through the methodology that this organization has chosen when selecting studies. We have a nice printable thing of the whole the whole thing that we will use in the video. And now we continue looking through the page, right? The research findings are here. Below are the 51 studies. And this is the part when we start going through the studies. So I think it would be best to look at what some of the oldest studies have given us, right? Let's look at some of the oldest studies. What do you say? The oldest studies here, that is. Let's look for the 1991. Do you mean the one? Do you mean the one run by Jon Mr. Atheist? Jon Snow? Is it Jon Snow? I know he's Snow, but yeah, that's one. Mr. Atheist? Snow? I think I know that. I do not know that Josie. I think he was one of the creators. And then he invites. I think he was by I'm gonna quickly show you who I mean, okay? Jimmy Snow. Yeah, Jimmy Snow. I'll show you. So like, I think he was one of the creators of the show, right? So anyway, I know Josie went on that. So how can you go on that? I don't know how you go on that. And will they accept me being a VTuber? Those are the questions. Those are the real questions. Where is the 1991? Oh, guess I have to find them manually. Colin. Oh, okay. When does that show happen? How do you call in? I have to check. See, I'm really looking for the 1991. 16. If you see 1991, then tell me. 99. 98. 96, 93. We'll look at this. I don't see the 91 now. Okay, we'll look at the 93 one. This is one of the oldest ones. Friedman Pfaffin MD. Where is the full thing? Using a data draw from the follow-up literature covering the last 30 years of the author's clinical data on 295 men and women after sex reassignment surgery, which means basically that it goes 30 years back before 1993. An estimation of the number of patients who regretted the operation is made. Among female to male transsexuals after SRS, i.e. in men, no regrets were reported in the author's sample, and in the literature they amount to less than 1%. Among male to female transsexuals after SRS, i.e. in women, regrets are reported in 1.5%. Poor differential diagnosis, failure to carry out the real-life test, and poor surgical results seem to be the main reasons behind the regrets reported in the literature. According to the 3 cases observed by the author, in addition to personality traits, the lack of proper care in treating the patients played a major role. So we also medical access, right? So this is the one, 1993. Let's get some other older ones. It would be probably quite good to... It'd probably be really good to call into the show. I have another piece of research from the Canadian Research of Ethics in Sport, published November 2022, review of scientific literature 2011-2021, inclusive. Of course, I'm interested. I am always interested in that sort of. We are doing a pretty important refutation of certain claims, right? There's a lot of citations here. The objective of this study was to evaluate the features and calculate the frequency of sex reassignment subjects who had applied for reversal to their biological sex, and to compare these with non-regretful subjects. An inception cohort was retrospectively identified, consisting of all subjects with gender identity disorder who were approved for sex reassignment in Sweden during the period of 1972-1992. The period of time that elapsed between the application and this evaluation ranged from 4 to 24 years. Okay. If you could link it, please. The total cohort consisted of 218 subjects. The results show that 3.8% of the patients who were sex reassigned during 1972-1992 regretted the measures taken. The cohort was subdivided according to the presence of absence of or regret of sex reassignment, and the two groups were compared. The results of logistic regression analysis indicated that two factors predicted regret of sex reassignment, namely lack of support from the patient's family and the patient belonging to the non-core group of transsexuals. In conclusion, the results show that the outcome of sex reassignment has improved over the years. However, the identified risk factors indicate the need for substantial efforts to support the families and close friends of candidates for sex reassignment. Yeah, I will get it in Discord. Would be best to link it in like the Politics Global, right? Politics Global, maybe, right? So I will wait for the thing. Okay, let me click on it. Let's get it in here. Paste. Alliance. Transgender Women Athletes and Elite Sports, a scientific review. This is very good. Thank you for this. And I think I will definitely use this. Although I think this warrants its own separate video. This actually goes back to my this actually goes back to my question to Stephen, to Destiny, right? How far into the past do you have to go until Stephen will say, well, okay, those studies are not new anymore? Like 30, 10 years, 30 years, 50 years, 100 years. How many years do the studies have to be conducted until they like become not new, right? I mean, like experimental is specific enough. The word experimental is actually specific enough that you can point to experimental means this, and this treatment is clearly not experimental. But new, however, is actually vague enough that you can point to 40 years and say 40 years it's not actually all that 40 years is not all that old, right? When you have, when you deal with people that are not really honest, right? It was originally posted a year ago, but was withdrew for further review until its official late last November. This is really good. Thank you for this. Thank you for this. I think we might just have to come back to the topic of trans women in sports as a separate topic and make a nice video on that topic as well. I would actually combine it with Conyers' video on the topic. I am not sure if you saw it. Conyer explained the history of how sports, certain sports were gendered in the first place, and it shows us a very interesting thing about the reality of gendered sports. So this is something for us to do in the future. Now let's take a look at those studies. Like let's pick one from 2006. We might also need to track some of those studies and read fuller versions. Patients reported complications and functional outcomes of male to female sex reassignment surgery. I am on youth savings committee to codify eligibility criteria for my sport. Is your sport sailing? Or what is your sport? This study examined preoperative preparations, complications, and physical and functional outcomes of male to female sex assignment surgery, SRS, based on reports by. I want to see if it's all just about SRS. Oh, I didn't know sailing was considered a sport. But sailing was considered more like a occupation. Gig. Giglers. 2014. There we go. Oh, this is more. It is an Olympic sport, so we have to work with the IOC guidelines released 2021. Ah, okay, okay. Abstract. Introduction. At the start of the gender reassignment therapy, persons with a gender identity disorder, GID, may deal with various forms of psychopathology. Until now, a limited number of publications focus on the effect of the different phases of treatment on this comorbidity and other physosocial factors. Is it Popeye? Aims. The aim of the study was to investigate how gender reassignment therapy affects therapy. Not so this is not just about surgery, I think. The aim of the study was to investigate how gender reassignment therapy affects psychopathology and other psychological factors. Methods. This is a prospective study that assesses 57 individuals with GID by using the symptoms checklist 90 SCL 90 at 3 different points of time: at presentation, after the start of hormonal treatment, and after sex reassignment surgery (SRS). Questionnaires on physosocial variables were used to evaluate the evolution between the presentation and the post-operative period. The data were statistically analyzed by using SPSS19 with significance level set at p less 0.05. Main outcomes measures. The psychological parameters include overall physoneurotic distress, anxiety, agoraphobia, depression, somatization, paranoid ideation, physoticism, interpersonal sensitivity, hostility, and sleeping problems. The psychosocial parameters consist of relationship, living situation, employment, sexual contacts, social contacts, substance abuse, and suicide attempt. Results. A difference in SCL 90 overall if psychoneurotic distress was observed at the different points of assessments, p equals 0.003, with the most prominent decrease occurring after the initiation of hormone therapy, p less 0.001. Significant decreases were found in the subscales such as anxiety, depression, interpersonal sensitivity, and hostility. Furthermore, the SCL90 scores resembled those of a general population after hormone therapy was initiated. Analysis of the psychosocial variables showed no significant difference between pre and post-operative assessments. Conclusion. A marked reduction in physiopathology occurs during the process of sex reassignment therapy, especially after the initiation of hormone therapy. So it seems like the most bang for your buck you get when you start hormones, which actually makes sense because hormones affect sort of your emotions, right? So that finding would make perfect sense, right? Even on a pretty intuitive level. So let's go to here. Because we have done things for Adults, and now we need to check for children. All gender-affirming care for children is 100% experimental. There are zero long-term studies on the effect the drugs and surgeries will have on them. So this is also basically Stephen's claim when it comes to trans youth and the transitioning early and surgery or anything else. Any sort of care. We have no real evidence that it's all new experimental. One very key finding of every study in effect of GAHT on her hematocrit levels, VO2 capacity, they drop to typical female levels after 6 months. LGBTQ advocates, including healthcare professionals, parents of transgender children, and representatives from several organizations, rally at the Texas State Capitol May 4th, 2021, opposing legislation that would criminalize gender-affirming care. Right? This is it. Is all gender-affirming care for children experimental? Experts say no. So I will have to think on how to make the essay. I will have to break it down to trans youth, and I will have to break it down to adults. So you have a lot to do. If your time is short, so this is a quick summary. It is me indeed. You are right in time to our research. Gender-affirming care refers to an individualized health care model that prioritizes encouraging and supporting a person's gender identity. Right? This makes sense. Before puberty, this care includes things like using the name and pronouns that align with a child's gender identity. At older ages, it can include evidence-based medical treatments such as puberty blockers or hormone therapies. Gender-affirming surgical procedures are not commonly recommended or provided to minors. Right. I know that's a thing. I know that usually when it comes to minors, the talk is about puberty blockers, not about hormone replacement therapy. Experts said gender-affirming treatments such as puberty blockers and hormone therapies are not experimental. See the sources for this fact check. Which means your blood does not carry as much oxygen, so even with male typical lung and heart capability, you're not getting as much oxygen to body tissue. See, that makes sense. That makes perfect sense. It's for education. It's for education. This is research for education, like, I don't know, maybe debate if need be, but I am making research to create a video that will be a rebuttal of certain claims, right? This video will include the findings of our research, basically. So I'm working towards a video essay about gender affirming care. It's not really for a debate, unless Stephen decides that he wants to debate. Our sources. The Texas Tribune. What is gender affirming medical care for transgender children? Here's what you need to know. We're debating a claim, but in the name of education. Exactly. Association of American Medical Colleges. What is gender affirming care? Your questions answered. Everything you need to know about feminizing hormone therapy. International Journal of Transgender Health. Is puberty delaying treatment experimental treatment? It's like putting a four-cylinder engine in the Formula One racer car, obviously reducing performance. Yeah, of course. Like, of course, if you're, no matter what your lung capacity, if what matters is how much blood is being transported via the blood. That's right. That's like a pretty key thing, right? Pretty crucial. So yeah, absolutely, Stephanie, absolutely. Absolutely. What I want to know, I assume that works in reverse, right? If you take testosterone, then I assume that those levels increase, right? To match that of assigned male at birth people, right? Is that a fair assumption on my part? Does the study speak of how that goes in reverse when you transition, like for trans men? I'll wait for your answer. And in the meantime, World Professional Association for Transgender Health, WPATH, Standards of Care for the Health of Transgender and Gender Diverse People version. We will use these sources. We will certainly use these sources when it comes to the video. So I want all of these links to be sort of here, available for me to access at any point. A big problem with many studies is almost all of the earlier studies is that they tend to compare cis men to cis women and use those results as applicable to trans women, right? Right. Right. What about trans men to cis men? Pubertal blockers for transgender and gender diverse youth. So we have a lot of citations here, as you can see. This is like not, there's a lot of studies here. The word, again, we again encountered the word experimental, which was also used by Stephen. The word experimental can trigger fear of the unknown and may suggest unforeseeable consequences or complications. Yeah, that is what we actually think when we hear the word experiment. And yes, with respect to trans men, their hematocrit levels rise to cis men over the same period of time. Yeah, that makes sense. That makes perfect sense. Lawmakers aiming to restrict access to gender affirming care have embraced the term, arguing that their proposals will protect children from such experimental treatments. And of course, a certain streamer has decided to accept that line of thinking as well, and thus basically aligning himself with the far right. A January 1st Instagram post echoed that alarm. All gender affirming care for children is 100% experimental. Read the Instagram post featuring a screenshot of a tweet. There are zero long term studies on the effects of the drugs and surgeries will have on them. This post was flagged as part of Facebook's efforts to combat false news and misinformation on its newsfeed. Read more about. I know about this. I know about this. I actually had a person that argued with me about vaccines, and their posts to me were also flagged and removed. So, yeah. Mostly false. Gender affirming care is an individualized approach to healthcare that centers, encourages, and supports person's gender identity, experts said. Some positive data comparing cis men to trans men. The World Professional Association for Transgender Health Standards for Care we're gonna take a look at this as well. Oh, Vietnamese, interesting. It's always trans people having to highlight the real data, and that's a real pain in the ass. Yeah, that's because it's always trans people having to highlight the real data because it's always trans people that are being scrutinized and basically like, how do you say, well, trans people are basically always told that they lie, basically. Stephanie, have you ever been on the Trans Atlantic show? The YouTube show? Have you ever been on it as a host? Okay. So the World Professional Associations Health Standard of Care noted that gender affirming care is more than just transition related medical treatments such as hormone therapy or surgical procedures. Gender affirming care for children might include allowing a child to wear whatever clothes they like or encouraging the use of the name and pronouns that align with the child's gender identity, said Dr. Michelle Forcier, a pediatrics professor who specializes in gender and sexual and reproductive health at the Warren Alpert Medical School of Brown University. Those types of emotional and social affirmation, which also include creating a safe space to explore gender identity, are important elements of pediatric gender affirming care, said Dr. Jason Rafferty, a pediatrician and child psychiatrist at Hasbro Children's Hospital in Providence, Rhode Island. Oh. Would you be able to link us the episode with you? The one that you hosted? Oh, Carasso, I guess great minds think alike. I guess great minds really do think alike. Wow. People that host those shows are usually so patient. Such patience. Forcier and Rafferty emphasized that gender affirming care for children is based on individual needs and goals. Social support is the only type of gender affirming care recommended for children before puberty, said Shane Diamond, a World Professional Association for Transgender Health spokesperson. As children reach adolescence, medical treatments might become part of their care. True, you are all heroes. It's true. It's true. Dr. Renata Arrington Sanders, an adolescent and young adult medicine associate professor at Johns Hopkins University School of Medicine, said there is an extensive body of evidence-based, peer-reviewed research on gender-affirming care. There you go. That informs current standards set by organizations, including the Endocrine Society, the American Academy of Pediatrics, and the World Professional Association for Transgender Health. So I guess we will use this quote because this is a really illuminating quote. Stephanie, are you able to contact Ben? Are you in any sort of contact with Ben? Like, if there's anyone that could tell us at least a bit about studies and what is our current status of studies, then I guess Ben would be a good person to talk to, right? I think so, right? Is Ben? Does Ben? I guess my first question would be is if Ben specializes in trans issues in any capacity, or not at all. I guess I assumed too much. I guess I am assuming a bit too much about Ben's education. So maybe is Ben's medical education related to trans care in any way? Yeah, but that would also depend if his specialization in medicine is related to the topic, right? Sun Live chat. Also remember, if you have the chat set to top, if you have it set to top chat, then remember to set it to live chat. That way you will see all the chats. Is this you?
So how are you both doing?
Not bad. Great.
And
Oh,
Stephanie, it's nice to meet you virtually. And
this person seems familiar, but I don't know from where.
so I have a bit of a spicy topic.
Yeah, lay it on us.
So, well, I've been surrounding myself in
Oh, what is this? Marinod Ghost. Oh my gosh. You're one of those people that can eat the most hardcore peppers?
like trans
Oh my gosh. Oh my gosh. Are you one of those people that can eat those hardcore peppers?
spaces and people as much as possible. I live in Florida. It's kind of obviously
My gosh.
pretty red. But since you guys have had this show on, I've shared it with everyone as much as I can.
Such
like, watch
beautiful hair.
this is an awesome show. Like, this is a community you should really pay attention to and learn about. And so basically a theme that's really come up in my mind as significant and that I've seen as significant is the idea.
Okay, this is really nice. This is really nice. Okay, so I will check it out later, and I guess I will like. I will like. I will subscribe. I should subscribe. Oh, okay. Let's go to this. So this is an important quote, right? Do you agree? Puberty blockers have been studied, used for decades. Oh, this is really important. Like, this is for decades. This is the red doll. I'm really happy we went to this article next, because this is for children, and Stephen says that this is just new and tested experimental for children especially. Puberty blocking medication might be an element of gender affirming care for children who reach puberty and experience gender dysphoria, a feeling of distress when their bodies don't align with their gender identity. Hello, Evelyn. We need to do research, and then I will need to create how you say, streamlined video based on the findings, which will serve as a rebuttal for Stephen's claims. And then we'll see if Stephen will cry and demand that I debate, in which case I have a plan. In which case I have a plan, okay? Puberty blockers help delay unwanted physical changes that don't match someone's gender identity. According to St. Louis Children's Hospital, they were first used in the US for gender affirming care in 2007, which is at least a few years ago. Thank you. Yeah, we have looked through one episode just a minute ago. They were first used in the US gender affirming care referees, but they have been prescribed in Europe at least since the mid 1990s. So that is the question, isn't it? Is this still new, or is this at least a bit old in Stephen's view, right? And Stephen used a very and I bet he would say, but I said en masse. But how do you do an en masse treatment or en masse research on a group that is small to begin with, right? Yeah, thank you, Giggler. As since the mid-1990s to treat adolescents with persistent gender dysphoria, the medication given children time to explore their identities and consider additional treatment options. Research, including a 22-year-old follow-up study, shows that medication helps alleviate psychological distress in adolescents and supports a child's development into adulthood. Puberty blockers contain gonadotropin, releasing hormone, analogs which suppress the body's release of sex hormones, such as estrogen and testosterone. Although puberty blockers weren't designed for gender affirming care, their use for this purpose. Although puberty blockers weren't designed for gender affirming care, their use for this purpose has been studied and isn't considered experimental by experts. This is important to note. Experimental in this context is a political term designed to create drama, confusion, and terror, said Fossier. Medical care is always being evaluated and studied so we can provide the best care. So I guess this is like a, again, a pretty direct answer to the claim. Every medication has side effects, Addington Sanders said, but doctors monitor the side effects of medications used to suppress puberty. Studies demonstrate the long-term efficacy and positive impacts that gender-affirming care, such as puberty blockers, has on transgender youth, said C.P. Hoffman, Senior Policy Counsel at the National Center for Transgender Equality. Hoffman pointed to a gender dysphoria research overview by doctors and researchers at Yale School of Medicine, the University of Alabama at Birmingham Children's Medical Center, Dallas, and other institutions. The researchers noted that studies in 2015 and 2022 found that puberty blockers helped young people with gender dysphoria. California State Senator Scott Wiener, de San Francisco, discusses his proposed measure to provide legal refuge to displaced transgender youth and their families on March 17, 2022, at a news conference in Sacramento, California. Gender-affirming hormone therapies also have scientific backing. Oh, my goodness. Come on. So, we continue. Feminizing or masculinizing hormone therapies might be another element of gender-affirming care that may be recommended when a patient is capable of giving informed consent around age 16, according to the Endocrine Society. Like puberty blockers, gender-affirming hormone therapy medications aren't approved specifically for gender affirmation use, and instead are approved and commonly used for contraception, managing menopause, for male pattern baldness, and more. Right? Of course, we know all this, which builds up on our experience when it comes to these topics, which is an argument that we cannot overlook. Right? We cannot overlook it, Gigglers. It will be a mistake of a lifetime. Come on. But the hormones themselves are considered safe and effective, especially when medically monitored, said Sierra Brown University. So, substantial evidence shows that access to gender-affirming hormone therapies when young reduces the long-term risk of suicide, anxiety, depression, and gender dysphoria. Gender-affirming surgeries are typically recommended for and provided to adults. Certain gender-affirming surgeries, such as masculinizing chest surgery, are sometimes provided to teenagers, though this is rare. There is not much research on the long-term impact they have on adolescents, the Rafferty said. Although I would imagine that if a trans man had a chest surgery earlier, they would be happy about it, I think. A trans man would be happy about it, I think. Some things about gender-affirming care, such as how it affects fertility, are still being researched, but experts said this is the nature of medicine and pediatrics. Rafferty said, when most people hear experimental, they feel it means that providers do not know what they are doing or are guessing when making clinical decisions, but additional studies and research happen routinely to learn more about a topic and to develop better practices and standards of care, which, I would hope so, I would expect so, right? That things are being constantly improved upon. I would hope so, certainly. Our ruling. An Instagram post claimed all gender affirming care for children is 100% experimental, There are zero long-term studies on the effects the drugs are and surgeries will have on them. On-label usages of JNRH agonists include treatment of preoccurious puberty, endometrious prostate cancers. Also, they cost a ton of money. Oh no. For prepubescent children, gender-affirming care does not involve medication or surgeries. Instead, it's about social affirmation, such as allowing a child to wear gender-affirming clothes or adopt a gender-affirming hairstyle. There's an element of truth to the claim there aren't many long-term studies of the effects of gender-affirming surgeries for youth, but that's because they aren't done on children and rarely on teenagers. We rate this post mostly false. There we go. And we have sources. Quite a long list of sources at that. So how do we feel about this? There we go. There we go. So I think this concludes that I think I will take it from here and start constructing the video which will show our findings, right? I think we have done our prayer, and I will finish it off by a reaction to a bad video that I've been wanting to react to for a long time now. There has been a thing that I wanted to react to for a bit now. We might not be able to finish it all, but there is, again, because Stephen is the king of bad claims. Destiny self-ID. Where we go? Where is it? Destiny on self-ID for trans people, but there's a newer one. There we go. Destiny explains why self-ID is hurting the trans community. Like, because the Stephen always positions himself as the expert of on what hurts the trans community, okay? Why self-ID is bad. From 4 weeks ago by Stephen, I guess. So there you go. Let's listen to what Stephen has to say. Yeah, it was nice. Like, it's very nice. I guess AI is more compassionate than Stephen. Okay? AI is more compassionate than Stephen. I guess this is my takeaway from the whole thing about Demon Mama, also known as Demon Mama and Demon Mama. Demon Mama, also known as Demon Mama and Demon Mama.
Only pro Valorant player upset that with people who just claim to be trans playing in the women category in Valorant.
Oh, I know, but read the description. It was composed by an AI. Okay. It's a part of my, I will explain in a separate video essay. I will explain in a separate video essay, okay? I have so many nice things for you all. Also, in 13 minutes, a new Demon Mama video will premiere.
Uh-oh. I started taking over injection / applying for legal documents changes for the betterment of my life after being diagnosed with gender dysphoria by a medical professional. Myself plus many other women / women identifying players are extremely concerned for the future. This is, I don't know if we can walk back from this cliff, but self-ID.
Cliff. This cliff. We. Who are we? You're Steven. Let's face it, Steven. You are not part of the we to begin with. Even though you weirdly try to insert yourself as part of the we, I guess.
ID is the cancer of the trans community.
Oh,
It
the
should
cancer.
have never been accepted. It should have never been pushed. It's not real trans people. It's not, and it has nothing to do with trans.
Oh, it has nothing to do with trans. I see. Steven is the expert of what trans is and what trans is not.
Self-ID has nothing to do with trans. It's a totally different esoteric aesthetic concept. Like,
Oh, it's an esoteric aesthetic concept. Okay, there's nothing to do. Okay, Steven. Okay.
it may as well be like the fashion shit that you have.
And the fashion okay.
You should believe that what is self-ID?
You should believe. Oh, Steven is going to tell us what we should believe. So strap yourselves in. Steven will explain to us what we should believe.
Self-ID is the logical fallacy of saying I am a thing
The logical fallacy.
because I say I'm a thing. And it stems from a fundamental misunderstanding of self-reporting to figure out what you are and assuming that you're actually just self-reporting what you are.
Basically, as opposed to the, in Steven's mind, non-logical fallacy of you are who you are if you jump through enough hoops to prove that you are. There you go.
That's not the same thing. It's hard for people to understand, but it's not the same thing. Like, I could say things like,
This is basically what Steven is saying, that the actual legit thing is you are who you say you are if you manage to jump through enough hoops to prove it. There you go. There you go. Okay, so remember when we talked about painkillers and how we accept someone's own amounts of pain to adjust medication? Yeah, I remember that.
there's a difference between reporting symptoms to get an idea of what I am versus just saying what I am. But the,
Symptoms of who you are? Are you saying that being a woman or a man is a disease and it has symptoms?
but the,
Symptoms?
yeah.
Never realized that Stephen viewed gender as a sickness.
But the,
But okay, I guess this is where we are. Gender is a sickness with symptoms now. We are learning so much today from Stephen.
but it's just been like such a, so when are you allowed to identify as trans? I don't like the terminology.
You don't like the terminology.
Identify as,
Oh,
are, right? You either are a trans person or you are not a trans person. You don't identify as whatever the fuck you want to identify with, and then everybody respects that. That's bullshit. It's just,
well, I guess if you say that, Stephen, then it must be true. So I'm not sure how someone else would know your relations with your own body and social role. Good catch.
stupid. And it's been a blight on understanding the trans
A
community,
blight.
trans
Oh.
issues. Like, if you are trans, then you have your pronouns, you can do your transitioning or not, or whatever the fuck.
Oh, I can. Thank you, Stephen. Wow. I can. Thank you. I guess with your approval, then great. You know?
Do, but it's not something that you identify as. That's cringe. All of that
Oh, cringe. Oh.
terminology needs to be fucking jettisoned. It won't be, because we're probably going to continue to head in that direction, but it's just destroyed people's minds in terms of understanding, like,
Oh, destroyed people's minds. From this logic, gay people should get a gay dysphoric to be a gay, a gay person. Homosexuality was also pathologized in the past. True.
And everything related to.
It still is. It wasn't it wasn't pathologized in the past. Okay, it still is. Let's like it still is.
Trans shit. What is the level of proof required to be trans? I don't know. Talk to a fucking therapist. I don't know what tests or metrics you would design to figure out if somebody is truly trans or not. But
Well, I guess like silver lining, Stephen would approve of me because I've been actually diagnosed by several doctors. So I don't know. I guess I pass in Stephen's eyes as the real deal, or something.
wasn't the original idea with self-ID to not gatekeep the shit out of transness, giving people the benefit of the doubt because it's so identify people as a real identity? I don't care. It needs to be gatekept. There's a lot of gatekeeping.
I don't care. It needs to be gate kept. What? That's so stupid. He seems devoted to the medicalization of human experience. Others get defined as, it seems. He may be open to correction, but not. He does have a penchant for self-righteousness. True. It needs to be gate kept. Okay. Are you gonna substantiate why you think it needs to be gate kept?
That should happen. Being trans is a really big deal. It's a really huge part of your life. It could involve medical interventions. It could involve big social interventions. Like there should be some gatekeeping. It's important to identify what that particular thing is and what it isn't.
Oh.
The idea that all gatekeeping is bad is just stupid, right? Like imagine like going to a clinic and being like, hey, I think I need heart surgery. Like I had a heart attack. And it's like, are you gatekeeping like the types of surgery I need? Or you like, yeah, of course.
This is really stupid. This is a really stupid example. And I can't help but to notice that once again, Stephen is sort of comparing a gender identity to a disease, a heart disease, directly. You know? Do you know what a real, actual comparison would be? A real comparison would be if a teenage girl went to a doctor and said, I want to reduce my breasts because I feel discomfort. And the doctor said, oh, can you prove it? Prove to me that you feel discomfort from the size of your breasts. And then we can start discussing your breast reduction surgery. That would be an actually closer example to what we are talking about. Okay? Not some example of I have a healthy heart, but I go to my surgeon and say, operate on me because I have a heart disease. You know? This is nonsensical. A trans identity is not a disease. General use of gatekeeping is negative as far as I know. We don't call medical professional interventions gatekeeping. We call them that regulation, right? So this is right off the bat really bad. Really, really bad comparison. Really, really bad argument. But what do I expect from Stephen, right? What do I even expect?
Can the same be said of self-identifying to who you are attracted?
And self-ID does not even... Like, this is another thing. Like, what is even the harm? Like, this is ridiculous. Heart surgery can cause death, okay? A transition can't.
To that. This is the issue with the word identify. Okay?
Oh, identify is evil.
There's a language game.
Language game.
Played, okay?
Okay.
Identify can mean one of two things, and the online trans activists hide in the ambiguity of that.
Oh, they hide in the ambiguity. Evil trans activists. Stephen is just a far righter at this point, isn't he? Evil trans activists hide in the ambiguity. As if Stephen never, like, because Stephen never hides in the ambiguity when he starts barking about the woke, like the woke agenda orthodoxy of the academia.
Identifying should just mean that you are stating a thing that you are, not becoming a thing, right? So for instance, I could identify myself as being 5'8", but there's an underlying reality. There's a fact of the matter that I am 5'8", and I'm stating what I am. When I identify as 5'8", I'm stating what I am. But I can't identify as 6'2", right? I can't become a thing because I say I'm a thing. I can't identify as being a 6 foot tall person because that's not true.
Does Stephen understand what an identity is?
Underlying fact of the matter is I'm not, right? When you identify...
The underlying fact of the matter, Stephen, is that you're an idiot.
As trans, it should be that you are making a statement about what you are. But
it's a statement about not identifying with the gender that you were assigned at birth, by definition.
You're not the thing because you say you are. You're just identifying what you are, right? I can make a lot of statements about myself. I can identify as Caucasian. I can identify as having slave owner grandparents, apparently. I can identify as having blue eyes. I can identify as owning a car. I can identify as like having an apartment. But these are statements that...
This is the helicopter thing.
I'm just telling you what I am. I'm not becoming that thing because I say I am. But for a lot of the trans activist people online, the identify thing has become like, oh, well, I am whatever I say I am. Like, I am. I identify this, therefore I am. But that's just, yeah.
This is...
Wouldn't the people that identify as trans say that they are trans? No. Even, like, listen to Demon Mama's arguments from a year ago. I remember listening while I'm playing DSP.
DSP.
Where she's arguing that, like, no, it doesn't matter if there's an underlying fact of the matter. The only...
Yeah, of course it doesn't matter, because there is no such thing as an underlying fact of the matter. It's cringe. It's idiotic to try to identify the underlying fact of the matter. It's a really stupid endeavor.
Matters is self-ID. There is no underlying fact of the matter. Somebody...
Yeah. It's cope to try to find some underlying fact of the matter. Thank you. Okay, so I guess now, thank you for this, thank you for coming to this TED Talk. But now, gigglers, it seems that a really good and based thing has started, and that we can go to the premiere of the Demon Mama video. Will you join me on the premiere of a really surprisingly wholesome debate that Demon Mama has had with a person? Unironically, Stephen Mama is smarter than Stephen. Yeah, he is. He is doing exactly that, Carasso. We will go to a premiere, okay? Those do not exist, Carasso. That is why. Stephen is conflating sex and gender. Stephen is conflating identity with a state of being, you know. Basically, it means that Stephen thinks you should be able to pass a woman or a man exam and receive a certification of proof that you are the thing. Okay? That is what Stephen advocates for. It did suck. So I will move into the premiere. Okay. And I'll finish the stream. And I'll see you in a moment, okay? I'll see you on the premiere, okay? I'll select end stream and I'll see you, okay? you guys bye bye and see you in a moment.